All right, so we have to take definition of family health nursing proper. So family health nursing is a care. Okay, you know all these things we have been saying since, we have been talking about since, is what? Care. Let me clean this board. All right, so let's talk about the main definition. We see that family health nursing family health nursing is a care. Okay, care or services. All right, is a care or what? Services. And these services is provided to who? To the family. It's provided to the what? Individual members of the family or members of the family. All right, and now that care or services they are providing to the family members, what is it for? What are they caring for? What are the services they are rendering? We know that the family health nursing is a care or services, okay, provided to the family members. Okay, let me add it. Provided to the what? Provided to the family members. Now, this is a point. Let's take another point. We know that family health nursing is a care or services provided to the family members, right? Now, let's take another point. What is the care? What are the services they are providing for the family members? What is it? What are they caring for the family? What services are they providing for the family? Now, that services they are providing for the family is for what? For the prevention, okay, promotion, okay, prevention, promotion, and maintenance of physical and maintenance of what? Physical, mental. Okay, you know most of this thing I've said it earlier. So physical, mental, spiritual. I hope we can see the board, please. If I'm obstructing the view, you can also comment at the comment section. You say, oh, next time that I'm doing that, I should not do this one, I should not do this one, please. Okay, and I stand for correction. All right, so they say they are the care or services they are providing for the family, for the individual member of the family or for the members of the family is for what? Prevention, promotion, and maintenance of what? Mental, spiritual, and what? Physical health. And physical what? Maintenance of physical, mental, spiritual, and what? Social health. I will explain that, okay? Don't worry. For the family. Okay? For the family unit. There's a reason why I did this, okay? So, and the individual members of the family. irrespective of what age and irrespective irrespective of what age and sex. That is the gender of the individual, right? The gender of the individual. So now let's go forward. Let's move ahead. All right. So I was saying something earlier that I said something like when caring for like in under community. Okay, when I was talking about that the community health nurse, community health nurse, we care for the what community, right? We plan or provide care or plan for all the components of community health for the community. And I mentioned something like after mentioning sanitation, I mentioned sanitation, immunization, I mentioned clean water, education, I also mentioned maternal and or child health care, right? And also I added that it is not just only those things that can actually affect the members of the community, that actually someone can have emotional distress. What happens is that the family health nurse will provide what education, like I said, that we under community education, we provide counseling for that individual so that individual can actually come out from that particular situation. All right, so now for this particular one I also mentioned if money, maybe when someone does not have enough money, if the person is financially down, it actually cause emotional issue also. Remember social stigmatization, like social, some people socially, because of their status, because they do not have enough money to meet up the demand of the society, what happens is that they become so timid that even socially they cannot connect. So that's actually a problem. But as a community health nurse, you will reach out to those people, you will provide counseling seminars that will actually bring them out from those their timid period, that timid self and that period that they are. So now talking about the family health nurse, the definition, okay, we all know that simply is a unit of what community health nursing. Now the definition is that this family health nurse is a care. Of course they are rendering care. Family health nursing is a care or services that are provided. Anyhow you're going to put the word, even if it's not just exactly what is written on the board, even if it's you just understand that this family health nursing is a care or services that are rendered or provided. Did you understand what I just did? That are provided to the what, to the individual members of the family or members of the family. Now what are they providing this why are they providing this care or services to the family or individual member of the family? Is for prevention, for promotion, and for what? Maintenance of what? Physical. Do you understand? Maintenance of physical. That should be another point. All right. Maintenance of what? Physical, mental, spiritual, social. You understand? Social what? Health for the individual members of the family or for family unit. When they say individual or family unit, they're talking about what? Either father, mother, or any, even if it's a boy remaining in the family, maybe the child is an orphan, it's a family. So what happens is that they're going to provide care services for that patient, for that particular individual. Now remember that we talked about they are doing maintenance, they are doing prevention, they are doing what? Promotion. And remember we talked about physical, mental, spiritual. Now example, someone that have lost their parent or someone that have lost somebody in the family that is important to that person. What happens? That person might be what? Mentally down. So what happens is that a family health nurse will actually help, like we said earlier, counseling. All these things are just like they are related because a community health nurse does not mean that you don't care for the family. But the point is that your duty is for the community, which the family is also what? Inclusive. Now for the family health nursing, your specific what? Duty is to care for the family, members of the family, individual, whether it's family that's a unit or members of the family, other members of the family. Now, irrespective of their age and their gender, all right? Irrespective of their what? Age or their gender, okay? So you must care for them. So that's your duty. So I want to leave this. Let's go to the order of the day. Maybe if I want us to revisit it, okay, we can revisit it. So now in this semester we started with family planning. All right, we started with family planning. I hope we understand the difference between family health nursing and community health nursing. And also we now know the difference between family health nurse and a community health nurse. All right, so let's go to, oh, I would have left that definition.